Hello guys, we hope you're doing very well, and welcome to our channel. In today's video we will be talking about the top 5 causes of death in the world, and we will try to explain them to you. So now, let's get started.
Number 5. Dementia. Dementia describes a group of symptoms affecting memory, thinking and social abilities severely enough to interfere with your daily life. Alzheimer's disease is the most common cause of a progressive dementia in older adults. Research shows that lack of exercise increases the risk of dementia. And while no specific diet is known to reduce dementia risk, research indicates a greater incidence of dementia in people who eat an unhealthy diet compared with those who follow a Mediterranean-style diet. The heavy alcohol use might lead to a higher risk of dementia too. And also cardiovascular risk factors. Although not yet well understood, late-life depression might indicate the development of dementia too. Having diabetes, especially if it's poorly controlled, can also lead to a higher risk of dementia. Smoking might also increase your risk of developing dementia. As well as low levels of vitamin D, vitamin B6, and vitamin B12. There's no sure way to prevent dementia, but there are steps you can take that might help. Keep your mind active with mentally stimulating activities. Be physically and socially active. Quit smoking. Get enough vitamins. Manage cardiovascular risk factors. Maintain a healthy diet. Get quality sleep and practice good sleep hygiene. Number 4. Lower respiratory tract infection. A lower respiratory tract infection is an infection that can affect the airways, such as with bronchitis, or the air sacs at the end of the airways, as in the case of pneumonia. Infections in the lower respiratory tract are primarily the result of viruses, bacteria, fungal infections, or mycoplasma, which are neither viruses nor bacteria, but are small organisms with characteristics of both. In some cases, substances from the environment can irritate or cause inflammation, which can lead to an infection. These include air pollution, tobacco smoke, chemicals, or many other substances. Risk factors that make a person more likely to develop a lower respiratory tract infection include a recent cold or flu, a weakened immune system, being more than 65 years old or under 5 years old, and a recent surgery. You can take many steps to prevent getting a lower respiratory tract infection, including washing your hands frequently, avoiding touching the face with unwashed hands, staying away from people with respiratory symptoms, cleaning and disinfecting surfaces regularly, getting vaccines, such as the pneumococcal vaccine and MMR vaccine. Getting a flu shot every year. Avoiding known irritants, such as chemicals, fumes, and tobacco. Number 3. Respiratory diseases. Respiratory diseases is any of the diseases and disorders of the airways and the lungs that affect human respiration and may affect any of the structures and organs that have to do with breathing, including nasal cavities, throat, or even the respiratory muscles of the chest cage. Asthma and emphysema are some of the common respiratory diseases. The diseases in the respiratory tract can happen due to many reasons. Reports in the medical world reveal the common factors, and these are low immune functioning, adverse climatic conditions and intolerable air pollution, excessive exposure to smoke and other toxic materials, inappropriate development of lungs during childhood or before birth, and presence of fungal, viral, and bacterial infections. As preventive measures, cessation of smoking is extremely important, as cigarette smoking is the most important cause of respiratory diseases around the world. Air pollution is also a significant problem in today's world, so the use of a face mask is also strongly recommended. In some patients, an asthma attack may be triggered by eating some specific foods or on exposure to cold. For this reason, avoidance of these situations is suggested for those patients. Number 2. Cancer. Cancer refers to any one of a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. Factors known to increase your risk of cancer include having an old age. However, cancer isn't exclusively an adult disease and can be diagnosed at any age. A lifestyle of smoking, drinking, or excessive exposure to the sun, and many other unhealthy habits. A family history of cancer. Your health conditions, as some chronic health conditions such as ulcerative colitis, can also markedly increase your risk of developing certain cancers. Your environment. Being around people who smoke, or also chemicals in your home or workplace such as asbestos and benzene, can increase your risk of cancer. There's no certain way to prevent cancer. But doctors have identified several ways of reducing your cancer risk, such as: stop smoking. Avoid excessive sun exposure. Eat a healthy diet by choosing a diet rich in fruits and vegetables and selecting whole grains and lean proteins. Exercise most days of the week. Maintain a healthy weight. Cut off alcohol. Schedule cancer screening exams. Ask your doctor about immunizations, as certain viruses increase your risk of cancer, and immunizations may help prevent those viruses. Number 1. Cardiovascular diseases. Cardiovascular disease, or CVD, is a general term for conditions affecting the heart or blood vessels. It's usually associated with a buildup of fatty deposits inside the arteries and an increased risk of blood clots. It can also be associated with damage to arteries in organs such as the brain, heart, kidneys, and eyes. The exact cause of CVD isn't clear yet, but there are lots of things that can increase your risk of getting it. These are called risk factors. The more risk factors you have, the greater your chances of developing CVD. The main risk factors for CVD are high blood pressure, smoking, high cholesterol, diabetes, inactivity, being overweight or obese, and family history of CVD. A healthy lifestyle can lower your risk of CVD. And if you already have it, staying as healthy as possible can reduce the chances of it getting worse. Ways you can reduce your cardiovascular disease risk are: stop smoking, have a balanced diet, exercise regularly, maintain a healthy weight, and cutting down on alcohol.
We hope you learned new things from the video. Do you know any other informations we've not mentioned? Let us know in the comments section below. Thank you for watching Duty World, and make sure to subscribe to our channel as more content is on the way.